everyone. Welcome to my poster entitled The Interplay of Stereotype Threat and Implicit Bias in the Clinical Setting. Introduction of a Practical Toolkit to Enhance Therapeutic Alliance in Dermatologic Care. My name is Brittany Wilson, and I'm looking forward to sharing this poster with you guys. So, I want you to consider this scenario. Will these two patients with atopic dermatitis have the same exact experience in your practice? You see, they have the same skin type 4, the same severity of disease, but do you think they're going to have the exact same experience in your practice? I think some of you are saying, I think they should, and others might have a bit of a pause and think there is something more than skin type factoring into the patient's experience in a clinical setting. Intuitively, we know this. But in this poster, I'm going to give you the vocabulary and a little bit of background for understanding concepts that you may not already be familiar with, so that you can be more aware of what could be happening with your minority patients in clinic and be equipped to prepare yourself, your staff, and your practice to optimize the care for every patient that comes into your clinic. So I'm going to give you another example. Imagine this black lady walks into your clinic. Here are some photos on the wall. Here are a few magazines on the table. Here's your receptionist and staff. And your patient notices that when the receptionist asked her for her insurance card, she kindly asks, "Do you have insurance?" Whereas with the following white patient, who is also new to this clinic, she asks, "Can I have your insurance card?" So let's examine this. I don't know how close this is to your practice, but I'm going to go through some definitions in this poster to give you the vocabulary to understand the role of implicit bias and stereotype threat in the dermatology clinical encounter. Your patient has been waiting for 37 minutes for her appointment. She's a corporate lawyer who had an important call to prepare for 90 minutes after her appointment. She considers telling you how inconvenienced she was by the wait time and your delay, but instead she decides to keep her feelings to herself because she does not want to come off as an angry and hot-tempered woman. Recall, you're 37 minutes behind schedule, and you finally greet your patient. You apologize for your tardiness. You notice your patient is rather quiet and nonchalant and does not seem to connect well with you. However, throughout the entire encounter, you are kind, welcoming, and do your best to come up with a plan for your new patient. Because you're feeling the pressure of running behind schedule, your interview and exam is a bit more rushed than normal. You give her the instructions, write prescriptions, and tell her to follow up in 2 weeks. But gauging from the lack of connection, you feel like she probably won't return or comply. And from your perspective as a physician, you don't feel you treated this patient any differently from any of your other patients that day. But it's the presence of these two terms I'm going to discuss later, implicit bias and stereotype threat, that does make this visit different for this patient compared to your other patients that day. Your patient is dissatisfied with your care. She remembers all prior experiences with white doctors, especially prior white dermatologists who she felt did not understand her skin or properly diagnose her conditions. She thinks back to the waiting room and how unwelcoming it was to people like her. She assumes you must treat all your black patients this way and differently, just like all her other doctors, and decides the next time she's going to go to a different dermatologist. Before I move on, I want you to think back to your medical school class. What percentage of your classmates were white and or Asian? What percentage of your classmates were black and or Latino? Now think back to your social circle. As a physician, what is the racial makeup of most of your friends? How many of your friends are black? How many of your friends are white? I ask this question because that is the single biggest factor in determining and eliminating the potential for implicit bias. If you are married to a Japanese person, then you will understand the Japanese experience and culture much more than your average American person. So your implicit bias towards Japanese people is going to be a lot lower than someone whose only experience with Japan is through karate movies. So with that, I'm going to pause with this introduction to my presentation, and as we go on through the poster, I will take you on a tour through the lens of the patient, the receptionist, and physician, and I will teach you a few words, and as I teach you about these words, I'll also teach you some tools that you can do to make your practice better